short version, I've kind of been somebody who has been between worlds for a long time. So I'm equally kind of have my foot in the movement world, as well as medical education, as well as dissection, all of these different things. So why I'm so thrilled and excited about this group is it's that collaboration. It is really getting people together and to have conversations, to understand and to work towards a common goal of our patients, clients, all of that. And this group really aims to do that. So a little bit on my bio, I came out of work as first a dance movement therapist in the psychological end of movement. And then after that master's degree, I was still had such a big curiosity about anatomy. Had a lot of questions that weren't answered, so took a deep dive into that world. And how I came, kind of into some of this myofascial work is I worked and studied for a long time with Tom Myers from Anatomy Trains, also with lots of other people in that whole area, like Gil Headley, did some work at, also studying at Mount Sinai, and have along the way picked up lots of different, understandings of how we talk about this whole new area. And I have taught at Pace University in New York for over 20 something years, getting close to 25. So long time that I've been there, and I've guested at places like Rush Medical in Chicago. And I also have a lot of private clients in the movement realm, kayak guide on occasion, all these different things. And you know me well, so you can add in some of the other fun stuff in there. I come from this background, and right now, I guess I should say this part, I'm doing a PhD in contemporary human anatomy education through program EVMS. Eastern Virginia Medical School has merged with Old Dominion University, which is a big research institute. So I'm going to be starting year 4 in this fall, and I know I'm rocking away at this. And it also is just exciting to me because I really do love that science communication between places. So that's been some of it. Been involved in the fascia, plastination project too along the way. And Freya, which some of your listeners know, was our big plastinate done with Body Worlds. And a group of international volunteers was really exciting to work on projects like that as well. Do some of my own dissection work too with things like K&M Lab, with things like this, and really excited to be here again. I've been here with you too since the very beginning of these conferences, and they get more and more exciting. I think it's just thrilling what we all get to do. So that's short part of the bio. Book, which you asked me about, so I did grab it. Myofascial system in form and movement is something too that I kept having people ask me to put some of this into, a book format, and lots of pretty pictures in there too. Easy to dive into at different levels. You're a guest writer in here, as is some other wonderful people. So we have conversations with a lot of folks. I think what has always fascinated me, especially around gait, and like we said, we're not just about gait in this particular conference, but that is for my presentation a little bit more of the focus. It's not just about these individual pieces and how they go together, but it's the continuity and it's seeming that fascia that gives it efficiency. As humans, when we became bipedal, standing up on 2 feet, we did a lot of miraculous things that other creatures haven't done in putting ourselves really upright. And also, whenever we're walking, running in that pattern, we're balancing as well. We have to balance for a time on one leg. And this sort of getting both that efficiency as well as getting the balance is really important. And I've studied this not only in myself, but in years and years of clients, and having a curiosity of how we can do this better or what's important. I see a lot of times we train people, sagittal plane movement, get their gait really well, but the moment they get outside, they're looking around somewhere else, and that's when they get thrown off balance, because real life is about things like, when I'm on the trail too, I'm not just walking or running forwards, I'm going, oh, there's an interesting word over there. Or, oh, hi, how are you doing over here? So getting those real life things in there along with the myofascial efficiency is part of what we're going to be exploring during that time period. As far as the dissection, we're very excited. We sold out very quickly last year. People were thrilled to do this, and already, if you're interested in it, get on it now
It's
because
a whole day, right?
it's a whole day, and we've
Yeah.
expanded it a little bit more as far as the number of tables we can have in and everything else. We will still limit space, so we want to make sure that we accommodate those that come in. I do this along with Dr. Brad Fullerton, and we're coming out of, I've been in medical settings, but I've also been in this world of myofascial for quite some time, and it's different. Partly too, because we've used, I mean, last year, new embalming technique, green embalm, which some people are familiar with, some that's a whole new world. And it is more like a soft fixative, so it's more true to the human body. So we can see movement still. We can see more of the fascial connections a little bit easier to see and retain because traditional embalming techniques like formaldehyde, which some of the doctors may remember from their training days, shatters those things. And this gets back to a lot of my fascination and what I'm aiming working on with my PhD is what we don't see affects what we learn and vice versa. So if you were a doctor who trained traditionally and had your gross anatomy dissection lab where we were very regionally based and quizzed that way, and also had a body that was worked on probably for about a year with formaldehyde, you're going to not have seen certain of the tissues that we'll be able to see during this time, or some of the connections, and just our viewpoint. We're focusing on a different aspect. So, of course, we're going to make different associations, and with that comes different insights and how this will affect, our patients, our clients, our own bodies. So that's one of the big ahas for I think everybody. And we're doing it in a very intense time, and we're focused around the subject matter for this particular C3 conference. And it's exciting. We get insights, and because everybody has such a wealth of knowledge too, we'll have discussions around those tables too about what we're seeing and what the implications are. It's great insight.
I,
And it doesn't need to be, but we're there to support as well. And I've trained out of Pilates for also about, I don't know, 30 something years more in yoga world as well. So I do have those things, and I still teach very actively in the yoga world. As far as dissection, because I see a lot of these different people from movement professions coming into labs because they have a curiosity and they deserve to be part of that conversation as well. So first of all, that's the welcome on in. We get sometimes frightened of what we don't know, or we don't completely know what our reactions will be, maybe even on a given day. Sometimes I've seen the doctors have a given day that something hits them differently because they're seeing whole body instead of maybe a very small focused field that they might see in surgery. So we are very supportive of that whole process, extremely respectful. And I have to say, this whole community, anyhow, has come out of a place of people that are that way. And you also, especially in a 1 day kind of introduction, you're not going to be having to worry about having to do so much as observe and be part of that, and also at your own level. Some people like to be right in there, some people like to be standing back, some people like to watch
Mhm.
on a screen. That's all fine. And usually, what I've found over the years too is there may be, reactions which are absolutely normal, but they quickly become fascination because the body inside is like rivers and mountains and, geography in a very rich sense. And we're exploring that. And these are donors who wanted us to learn. So that's kind of
Mhm.
their gift to us, is being able to give that and be able to see under the surface and get new insights in there.